Good afternoon, everyone. Thank you for joining us today. I am Rhonda Smith, the Executive Director of the California Black Health Network, and welcome to today's Health for Life session called Let's Celebrate Life. As some of you are aware, April is National Donate Life Month, and it is a time to celebrate life and honor the gift of organ, eye, tissue donation. And for those of you that may be in our audience today and in our world who have saved lives through the gift of donation. In recognition of National Donate Life Month, we are highlighting 4 amazing Black fearless leaders who work to increase access to this critical life-saving option. They are Morgan Reed, who's the Director of Transplant Policy and Strategy for the National Kidney Foundation, Tiffany Jones, Head of Production Communications and Strategic Partnerships at One Legacy, Janice Whaley, who's the President and CEO of Donor Network West, and Roisin or Rock McLaughlin. He's a donor recipient, patient advocate, speaker, mentor, coach, and many more things. And so why are we talking about this today? Well, there's a need in our community for more organ donors, for sure. And so the need for organ donors is much greater than the number of people who actually donate. So more than 28,000 lives are saved every year by organ donors, but about more than 123,000 people in the US are on the organ transplant waiting list, and about 21 people, unfortunately, die each day waiting for a match. And so patients from communities of color make up about 60% of the national transplant waiting list, but only about 40% of the population of donors. So this means that folks like us, particularly Black and Latino people, are overrepresented on the waiting list. And so it's very important to consider being an organ donor and also a living donation. And Tiffany and Janice will be talking about that shortly. So before we get started, I just wanted to cover a few housekeeping items. So we will hear from the panelists first, and then we'll be followed by a Q&A. So if you have any questions, please put your questions in the chat box. If you see someone that you want to give a shout out to, you can use the chat box for that, or make any comments or share thoughts as we're going through the different presenters. And so before I get into our first guest, I'd like to just say a little bit about the California Black Health Network for those of you who may not be familiar with who we are. So next slide, please. So the California Black Health Network was founded in 1978, and we became a 501c3 in 1983. So we celebrated our 40th anniversary last year. We have become, the voice and trusted resource for Black health equity here in California, and continue to strive to do that every day. But we are the only Black-led statewide organization, I say, that is dedicated to advancing health equity for all African Americans and Black immigrants. There are some organizations that focus on specific health conditions or are gender specific, but we cover all aspects of health and well-being for Black Californians. Next. Okay, next thing. Yes. So what we do is conduct outreach, education, and advocacy to achieve health equity for Black Californians. And we do that through the lens of understanding the critical issues that lie at the intersection of racial justice, social justice, and environmental justice. And so we hope one day we can really envision or see a California where every African American and Black immigrant has the opportunity to live a long, healthy life that's free from violence, racism, and health inequities. And we work towards achieving that vision every day through our mission, which is to ensure that all Black Californians, really regardless of how well educated they are, how much money they make, where they live, who they love, how they self-identify, and so on, has the opportunity to access high quality, equitable primary as well as behavioral health care, and definitely avoid unnecessarily succumbing to any disease, and definitely those that are preventable. Next slide, please. And so I'd like to begin by introducing our first esteemed guest, that is Tiffany Jones. Tiffany manages communications and strategic partnerships at One Legacy, which is an organ procurement organization. She has had a robust career for over 10 years in communications, event planning and producing, and partnership development. As co-chair of the 2023 Donate Life Rose Bowl Parade float, Tiffany's team received the highest Tournament of Roses honor, that is the Sweepstake Award, garnering global attention for One Legacy's mission. She also has developed Connecting the Dots, which is a panel conversation series to educate and empower our communities across the state, mainly in Southern California, about health advocacy and the importance of organ donation. Tiffany uses a mix of earned media, paid media, civic engagement, and philanthropic strategies to reach a population of 20 million diverse residents in Southern California, with key messages related to the importance of organ, eye, and tissue donation. So without further ado, I'll turn it over to Tiffany. So thank you for being here today.
Greetings, everyone. How are you? Thank you for having us today, Rhonda. And thank you to the California Black Health Network for putting together this much needed conversation. I'm very excited about the work that we're doing together, One Legacy and CBHN, really to advance health equity and bring awareness to both of our communities about the important need for organ donation and beyond. And then to our esteemed panelists that I'll be sharing this conversation with today, I am very excited to hear from all of you. And so I'm looking forward to a great conversation. Jumping into some of the important topics when we talk about the state of the Black community and organ donation. I really want to, share first that this is a complex but evolving system and process. And so with this, we have so many people that are impacted, as you mentioned, Rhonda, on the wait list. And so I'm going to advance my slides here.
Not sure.
And so when we talk about what the needs are, and can you see my slides? Are you all seeing my slides?
Not yet.
Excuse me for that. And so, as I mentioned, there's a huge need in our communities where we have over 103,000 people waiting for a life-saving transplant, and 60% of that is made up of communities of color, BIPOC, and African-American communities. So what is organ donation? Organ donation is a medical procedure that saves and transforms lives. Simply put, it is when one person decides to give a gift of life through organ donation to someone else in need. And this can happen two ways, as mentioned earlier, which is through living donation or deceased donation. 70% of the organ donation transplantation takes place through deceased donation, and we have about 30% that is living donation. And I know Morgan Reed will be able to speak some to that as she talks about some of her information with the National Kidney Foundation. So who is One Legacy and what do we do? One Legacy, we are an organ procurement organization, and we are the bridge to life for millions. We have a diverse population where we have over 20 million residents, and we have over 215 hospitals and 10 transplant centers that we are working with on a 24/7, 365 basis to really facilitate the need for donation. And our communities are made up of 70% of communities of color. And so the need to really focus in on Black and brown communities are very important, as it is a concentrated group, a large group of diverse communities here in our service area. So understanding what does that mean? So One Legacy is the critical connector to facilitating donation and saving lives. And again, we have those 215 hospitals that call in with referrals. And then we have a team that's dispatched out to go and speak with families about that potential donation opportunity. We also support the families after they become donors or once they start that donation process. And we do this with our family support team. They provide grief support. They follow the individuals during this journey as it's very new. Oftentimes it's unexpected when someone becomes a donor. And so we want to make sure that we're positioned to provide resources and support for those families that are grieving. And hence, this is why we are doing some of the work we are with groups like the California Black Health Network to even get further outside of our echo chambers to make organ donation normalized. So the gift of life and who receives it. In organ donation, you can save up to 8 lives. And you also have tissue donation, and you can also restore the sight as well through cornea donation. And so lives are saved and enhanced literally through organ donation. Here are some of those organs. Here are the organs and corneas, tendons, skin, bone valves that could be donated. So let's get into the numbers. Organ donation, transplant waiting list by the numbers. As I mentioned, there's over 103 people waiting. 28,000 are African Americans in the US. 20,000 of those people are waiting right here in California. 17,000 are waiting on kidneys. 1,900 African Americans right here in California, as we're talking to our community, and we see what the need is right here in California. We have over 1,900 waiting African Americans, but then we have 1,700 African Americans waiting for kidneys. So as you look at these numbers, you would say, wow, that's a big number. You have 1,700 out of 1,900. Well, the need for kidneys are exacerbated. And this is why it's important to really think about organ donation, consider living donation as an opportunity to help save someone's life. And particularly when we think about the African American communities and the complexity behind the match, less than 1% of those that have decided to be a donor, they said yes and authorized, are actually eligible for donation. So that means even if you are a registered donor, you said yes, only 1% are able to be a donor. And that's not to scare you or discourage you, but that's to encourage you to share that the need is great and that we need more registered donors. And typically out of those that can be a donor, 3 out of those 8 organs are actually healthy enough for transplant. So again, it's evolving, but there's work to do and we can do it together. And so when we look at the state of health equity and organ donation, and we talk about why is the need so great and why are kidneys so high on that list? Well, we know that it's more pronounced in communities of color where we have a disproportionate rate of diabetes, high blood pressure, heart disease, and a lot of these causes often lead to organ failure. 32% of organs come from multicultural backgrounds, but 60% of those on the waiting list are actually from those communities. And so when we look at the waiting list by ethnicity, African Americans are a minority, but we are a majority in need. And we are a majority that are currently waiting for life-saving transplants. So when you look at things like structural racism or systematic racism and implicit biases, these are some of the reasons that we know exist and has impacted our communities for a long period. However, on the flip side of that, we can kind of take control and become more involved and, take advantage of our health and become advocates. And so I want to dispel a few of those myths that do exist around organ donation. And one may ask the question, African Americans don't get enough transplants. Why would I say yes to donation if my people don't get it? And I've heard this question. It was asked to me when we were at the Englewood DMV doing some education. And I was able to share a story, and I'm going to advance to the next slide. In the fact here, organs are assigned based on the UNOS waiting system. And in fact, African Americans and other communities of color are actually getting transplanted. And here, I'll show you some of our recipients that have received that gift of life. When we were at that Englewood DMV, I was there with Miss Vinnie, as we call her, Miss Vinnie Brooks, and she is a heart recipient. She was able to share her story with the gentleman who actually said, why would I give if my people don't get? And she said, hold on, wait, who doesn't get organ transplants? And Miss Vinnie was able to share, I'm your people, and I got a transplant. And, his mouth was really dropping to the floor. And he was like, "Oh, really? Really? Well, I'm too old. My organs aren't valuable." And we said, "You don't make that decision. We let medical professionals make that decision." And so that was on the spot an opportunity where Benny was able to educate, and that gentleman became a donor, and about 4 other people followed him and became a registered donor that day. We also have Gerald Freeney, who was diagnosed with cancer and also received a liver and a kidney. Gerald received his liver and kidney, and that has been able to advance his quality of life. And he went all the way up the ranks to become the first Black president of the Tournament of Roses. He's also a One Legacy ambassador. And we have Simone Washington, who received a kidney transplant at a young age. Unfortunately, a gentleman died to gun violence, and he was able to save her life. And so it just shows the circle of life that is given. And Simone, she actively engages with our One Legacy Ambassadors program. Anthony Villahermosa, he was a donor, father of 3, and his life was taken early. His mother is actively involved in our ambassador program, and Anthony was able to save the lives of 4 people. And so it just shows how the circle of life takes place through organ donation. One gives, the other receives, and then we hope that people would ultimately give back. So as I close, I want to just say becoming an advocate of your own health is really what's going to propel you forward in your health journey. Getting your checkups, getting your workouts, knowing what opportunities exist for you, and health literacy. Becoming more literate in your health is a critical connector to navigate some of the disparities that exist. Let's make sure that we don't take no for an answer, and that we find out what's best for you and your outcome, and ultimately what you can be able to produce for your community. So I want to thank you, Rhonda, for the work that you're doing and this opportunity to share with you all.
Well, thank you very much, Tiffany. I have lots of questions, but I'm going to save my questions until we get to the Q&A part, and we will actually queue up for Janice next. Okay, great. Thank you. So our next speaker is Janice Whaley. She is the Chief Executive Officer of Donor Network West, which is the 2nd largest organ procurement organization in the U.S. Janice joined the organization in January of 2019 and has really made a significant impact on their success and engaging more donors to give. So after she arrived at the organization, she substantially increased recovery performance across multiple metrics, saving hundreds of more lives. And before she joined Donor Network West, Janice held leadership and clinical roles in 3 other OPOs or organ procurement organizations, achieving very similar results. She moved to California, it looks like, from Oklahoma, where she was the chief operating officer for an organ procurement organization there called LifeShare. And before LifeShare, she was in Texas and had the role of director of clinical operations at LifeGift in Houston. So most recently, Janice was appointed to Access to Healthcare Networks, or AHN, which is the governing board of directors. AHN is a nonprofit organization that provides access to healthcare services that help individuals, families, and organizations manage healthcare effectively and more affordably. So I'll turn it over to Janice to share with us some insights today around organ transplantation.
Thank you very much. Good afternoon, everyone. It's a pleasure to be here, and I want to thank the California Black Health Network for inviting me to share just a few thoughts. Tiffany and I are both from organ procurement organizations, and so I must apologize up front. I do not have a map of my service area, but just so you all will know, and I'll tell a little bit about our story at the very end. We cover Northern California and Northern Nevada, so San Francisco all the way up to Northern Nevada, Reno area. So I will start by talking a little bit about the wait lists, transplants, and donors, organ donors, so you can get a clearer picture on what's taking place. So just a little bit about the wait list, and I know Tiffany kind of shared this a little bit with you all, and I want you to kind of look at it differently here for just a moment. There's nearly 90% of patients that are waiting for kidneys out of the 104 total are waiting for a kidney transplant, as you can see here. And on my next slide, you see where Blacks make up 30% of the wait list for kidneys. And Blacks make up about 13% of the general population. So there's a overrepresentation of Blacks waiting on kidneys for transplant. And obviously we know the different socioeconomic status, diabetes, hypertension, that are the reasons behind the overrepresentation. Whites make up about 60% of the general population. Hispanics, Latinos make up about 19%, and Asians make up about 6%. So there's probably in total a little bit more, around 62% of the kidney wait list are for people of color that are waiting. And so that's just an important thing to think about. So when you look at transplants on the other side, most of the transplants that we do in this country are kidney transplants, nearly 60%. And as you can see, Blacks make up about 36% of the kidney transplants that were done in 2023. So the majority of those transplants that took place were transplanted into transplant patients, into Black, Black patients. If you move forward to donors, it's a little bit of a different story. So first, let's talk about the national trends in organ donation in this country. I'd like to point out that in 2001 to 2003, living donors actually exceeded deceased donors. In 2003, the National Breakthrough Collaborative began, and the goal was for all three estates, your donor hospitals, organ procurement organizations, and transplant centers to come together and share best practices to increase donation rates to upwards of 75%. And that was because the need was so great. And, you know, a lot of people cannot be living donors. You can be tested, but you're not always going to be capable of actually being a living donor. And so it was very important that we look at what's going on the organ, the deceased donor side, to see how we can increase the amount of organs available for transplant from deceased donors. So while there has been about a 15% increase in Black patients receiving a transplant over the last 20 years, donation rates amongst Blacks have relatively stayed the same. There's been a less than 5% increase in 20 years. So that clearly points to the need for awareness, for education about donation and transplantation, and our opportunity to dispel the myths and misconceptions that allow for Black families to say no to donation. But again, a lot of us are needing a kidney transplant. So it's very important that we look at how we can increase awareness so that more patients on the wait list can receive a transplant. So now let's talk a little bit about the why, the inequities in Black American donation and transplantation, and the reasons why we are challenged in this area, and how we can, moving forward, make a difference. So everyone knows that there's a lot of health conditions that cause us to, mistrust the healthcare, the public health issues that allow us to mistrust the healthcare community. Even amongst active status patients, white and Hispanic individuals have a greater probability of receiving a transplant than Blacks. some of that has to do with awareness. There is not a very clear pathway on educating Black patients on how they can receive a transplant. Blacks wait longer for a kidney transplant, up to twice as long for a transplant as whites in some areas. And for highly sensitized patients, there continues to be less access to kidney transplants in the Black population after the implementation of the kidney allocation system, which I will touch on a little bit later. Multiple studies have demonstrated that kidney donation rates for living and deceased donors are decreased in areas with high burden of end-stage kidney disease, which suggests that areas with the greatest need for kidney transplants have the most limited supply. So therein you have the challenges that we face as Black Americans in our ability to be a donor and also to receive a transplant. So there's also clinical bias in medicine, considering the many events in 2020 highlighting this country's issues with systemic racism. Many in healthcare have begun re-evaluating issues related to equity, access, and delivery of healthcare in minority population. Herein lies the final problem with the use of race as a risk adjustment. Race in and of itself remains a social construct, quite different from the genetic ancestry. The designation of race does not consider factors such as socioeconomic status, the effect of racism on individuals, their environment, and also genetics. So race risk adjustments really has no place in evaluating people when they need to receive a transplant or whether or not they receive a transplant. And so I put a couple of articles in here that talk about that, where in the past, and I don't know, maybe it will be touched on later, there was this algorithm that was used that made Black patients waiting on kidney transplants wait longer. And as you can see here, those reports allowed for Blacks to have a higher value, which disadvantaged them on the wait list. It delayed referral for specialty and then also delayed referral for listing for kidney transplantation. 20 years ago or better, many clinicians voiced the concern, and it wasn't until 2022 that finally this algorithm was removed from evaluating patients for the wait list. If you think about it, we should question ourselves how many patients died because of this race risk adjustment factor that was in there. And the answer is many people lost their lives waiting longer than they should have been waiting. And so once they've changed that, it's amazing how now patients are waiting less. But I don't want to focus on this a lot, but my concern is the many people who were denied an opportunity for a second chance at life because of these type of race risk adjustment and different tools that are used and have no place in evaluating someone who has organ failure. And so we're moving forward, but for those who lost their lives waiting on this to change, it is a tragedy. So I mentioned earlier on December 5, 2022, the Board of Directors of the Organ Procurement and Transplantation Network unanimously approved a new policy that would backdate the waiting time of Black kidney transplant candidates who were disadvantaged by the previous use of race-inclusive calculation to estimate their level of kidney function. While this is a significant step forward in ensuring equity and access to transplant opportunities for Blacks, this is another example of how Blacks have been and continue to be unjustly pushed to the back of the line and offered substandard opportunities for a healthy life simply because of the color of our skin. It is also another example that Blacks can use to justify why we do not trust the healthcare system. Yet and still, while I disagree with the previous and now current policy, which talks about HLA and matching points that still unfavorably favor white candidates over Black candidates in receiving a kidney offer, that cost many Blacks their lives due to the accrual of longer waiting times and ultimately their inability to receive a kidney transplant in time. Correcting this wrong is a move in the right direction. As an executive with 3 decades of experience in the organ donation and transplant industry, I offer Blacks hope. Hope that with this new policy, we are turning a corner for equity in transplantation. I strongly recommend that Blacks continue to advocate for themselves, to fight for the quality health care we deserve, including the right to be listed on the organ transplant waiting list, receiving waiting time points, equitable, but as well, and ultimately and timely receive an organ transplant that affords that second chance at life. And so you can see my slides will be available after this. But one of the things that I want to point out that one of the physicians who did some research on this said that the EGFR links used of race as a variable is the troubling history of racism in medicine. It all traces back to this legacy of trying to put biology into race. Instead, race is a social construct that has been used to justify atrocities against certain groups of people. It is an insidious thing that has been going on since the beginning of the country. This is not me speaking. This is Dr. Vanessa Grubbs, and this was in response to her research that she did on this particular calculation that denied Black patients a second chance at life. So let's switch over now to a little bit about donation rates in this country and the opportunity for us to raise awareness in this area. We currently have a metric that CMS has put in place to determine our performance as it relates to donors and organs transplanted. And so the donation rate in this country, as you can see, there's a huge disparity. So those places that have calc deaths, which is the deaths that by race and ethnicity across this country that we use to determine whether or not there is potential, you can see, for example, St. Louis at the top, Missouri at the top, they have a small population between 250 and 499 calc deaths. This is cause, age, and location. It is within the metric that we use to determine potential donors in this country today. So while they have a high donation rate, they have a very small number in terms of the population, the Black population that they serve. If you follow the trail downwards, South Carolina has a median population between 500 and 999. But then right there in the middle, lower, you have a lot of dark bars that depict the larger areas that have a higher population of Blacks that live in those areas. And as you can see, California, Texas, our rates are pretty low. And if we could allow for everybody to get up to a median between 13 and 14, we certainly could increase the amount of donors and organs that will be available for transplantation. So as you can see, from the bottom to the top, there's a 3.7 times performance variation, which speaks to the fact that how are we focusing in on these communities and making sure that we're bringing the right intentional, focused education to these communities of color. That is concerning. What are we doing when you see this huge disparity that is taking place? And so I want to pivot to the donor network story on how we looked at our population. And just to share with you, we serve about 14 million people, and 60% of them are people of color. And when you look at our potential, meaning donors that could potentially be people who could potentially be organ donors, 60% of them are also people of color. And our staff at the time when we started looking at this was grossly overrepresented by white employees. And now today, our staff is 51% people of color and 49% white. Our organization, as noted in many areas, should reflect the community that we serve. Our community should see themselves in our organization. They should see themselves in the transplant ecosystem. And so we worked really hard to ensure that our organization reflected what our community was. And so some of the things to take away from this meeting when you're thinking about if you're working on what your organization looks like, we wanted to make sure that we represented our community and that it mirrors our community in perception and appearance. Public trust requires a word and deed transparency in our system, a belief that people of all socioeconomic walks of life are represented as a system stakeholders, and a shared belief that everyone in the public can benefit from that system. Many of us have spent the majority of our careers building trust in the nation's organ donation system. And in my case, particularly amongst people of color, in recent decades, we have spoken repeatedly of the need for everyone to be seated at the decision-making table. In large part, that goal of inclusion has not been realized, but now is the time. People of color must be seated at the table and proportionately embedded in the leadership amongst our organ donation and transplantation stakeholder organizations. People of color want to see themselves in the system. The transplant ecosystem needs their direct and proportionate input, and not by proxy on decision-making bodies throughout all levels of the ecosystem's organizations. Proportionate requirements for racial and ethnic composition of OPO staff, including leadership staff, clinical staff, donor family services staff, and overall staff composition, will help organ procurement organizations to maximize the donation rates by possessing flexibility of organizational knowledge, generation, and representational stance of the organization's community that it mirrors. So this slide shows the trending of Caucasian versus minorities within our population that we serve. Donor Network West, because of some of the slides that I showed you, had a significant more increase in minority donors than Caucasian donors in 2021. And as you can see, we have sustained that growth and kept it, and it actually reflects the community that we serve. We should have more people of color donating than whites because our population reflects that. 200 minority donors this year is an amazing organizational record for us, and we're very proud of the intentional work that we've done amongst people of color to get to this state. So I'm going to go backwards to how we're doing with donation amongst our Black community. And I also want to add that minorities do donate, given the opportunity with the right representative and the right message. Since 2018 through 2023, Donor Network West has increased the authorization rates by the following in our various communities. We've increased donation by 16% in our white population, increased 15% in our Hispanic community, increased 39% in our Asian community, and a whopping 77% increase in the African American community. And in 2022 or 2023, our authorization rate amongst Blacks is at 65%. We totally represent the community now that we serve, but we can still do better. So these rates are great, but there's still more work to do, and still many, many more people of color, including Blacks, that will donate if they receive the message and if they can see equity and inclusion throughout our processes. So we are very goal-driven, and accountability to our mission is measured by the donors and the organs that we transplant, and how many people are we really getting off the transplant wait list. So we should always be thinking about what that looks like and how we can ensure that we have the right people in front of every family every time, and that we intentionally look at the issues and the concerns that are brought up when it comes to donation and transplantation amongst people of color. Thank you so much for your time.
Thank you, Janice, and congratulations on all the success you've had and the impact that you've had on the organization and increasing the number of organ donors for our community. So next up, we have Morgan Reed from the National Kidney Foundation. Morgan is the foundation's first director of transplant policy and strategy. And she joined the team, and I think for her, I've had the pleasure of meeting Morgan in person. And I think this is probably her dream job, just based on her personal experience and passion. And so she says this is one of the most exciting, I think, professional endeavors that she's had so far because of all of that, and her vision to provide transplants for all who really need them, regardless of their race and ethnicity. So she works to level the playing field in this role so that each person diagnosed, especially with chronic kidney disease, has a fair shot at a transplant. And then regardless, again, of their race, where they live, or their economic or socioeconomic status, each person deserves a chance to have a long, healthy life. And so before she joined NKF, Morgan's passion for saving lives through the selfless gift of donation began when she received her own kidney transplant in January of 2007. So she was diagnosed with chronic kidney disease when she was about 18. And over the years that followed, her kidneys would fail, and leading her to a 2-year journey on peritoneal dialysis before receiving a life-saving transplant from one of her dear college friends. And so she's since dedicated her life to raising awareness about the importance of organ donation and helping as many people as possible receive this life-saving alternative. So I'll turn it over to Morgan to share with us some information about chronic kidney disease, her journey, and personal story. So thank you, Morgan.
Thank you so much, Rhonda, and thank you to the California Black Health Network for this opportunity. Yes, my name is Morgan Reed. I'm the Director of Transplant Policy and Strategy at the National Kidney Foundation. I always joke and say my name is Morgan, rhymes with organ, Morgan. You can't forget my name. But I'm going to speak to you very quickly. I want to make sure my brother Roisin has enough time to share his story with you all. But I want to share that the National Kidney Foundation is hyper-focused on making sure that everyone receives a kidney transplant through our Transplant All initiative. This is our organization-wide initiative to ensure that no one dies while waiting for a kidney transplant. We want to make sure that everyone, our vision is to make sure that everyone that needs a kidney will have the opportunity to receive one if they would like a transplant. And so our 3 primary objectives for Transplants for All is to increase living donation, increase deceased donation, and advance equity in kidney transplantation. And again, we do this across the organization. This isn't just something that we focus on in one area at NKF, the National Kidney Foundation, but it's, again, we're really taking an organization-wide approach to achieve those 3 objectives through professional education, research, innovation, policy, and advocacy, which is the work that I do, through awareness and through patient programming. These are the ways that we hope to achieve the 3 goals that I just shared with you. So our first goal Increasing living donation. This is not a comprehensive list of everything that we're currently working on, but these are just a few things that we're doing to try to increase living donation. One of our patient advocates, Mr. Bullock, shared, "I donated to my husband 11 years ago. He has had significant improvement in his health and well-being. I gained the satisfaction of having a positive impact on his life, a win-win." And you know what? I have to agree. My best friend in college donated her kidney to me 17 years ago, and she says that it's a win-win for her too. A win for me, right? Because I get to live another day, and a win for her because she always says that there's not many opportunities to do something magnificent for someone in life, and that is why she donated a kidney to me. But this is how the National Kidney Foundation is improving living donation. LDPA, the Living Donor Protection Act, is a law that has been passed in 32 states to prevent discrimination from life insurance and disability and long-term insurance companies from discriminating against living donors. We've passed this again in 32 states, and we are continuing to pass this on a federal level. We would love to see this codified into federal law so that anyone that wants to donate a kidney can take FMLA and have job protection. We're also raising awareness through patient education programming. People don't know what they don't know, right? And so the National Kidney Foundation has a catalog of educational resources to help people understand living donation, what it is, what the process entails. We also are working with DaVita on a patient navigator pilot. I'm really excited about this. I didn't have a navigator when I went through my process 17 years ago. The navigator pilot just ensures that people have the support that they need and deserve while going through the process. Everyone doesn't have support. So it's nice to not go through this process alone. And I can tell you for myself, even though there weren't any patient navigators to my knowledge when I was going through kidney failure and exploring the transplant process and then actively going through it, I was very supported by my friends and my family, but it was difficult, right? Because they had never, like, no one had experienced kidney failure in my family, none of my friends had either. So it was hard for them to really understand all that I was going through. So having a navigator um, is important, and it's a great resource for those looking to go through the living donation process. Increasing deceased donation. One of our advocates just said, Mr. Blankenship shared, "Because of my transplant, I got to celebrate my son's 5th birthday." This speaks to me because when you receive a kidney or any life-saving organ transplant, you realize just how precious life really is. And I'll speak for myself, I'm very grateful every day. I live my life with a lot of zest and excitement, really just to be alive, because I know how close to death I got. And also birthdays, right? Like, listen, my birthday is May 3rd. It's coming up. It's next Friday. I celebrate the entire month. It's called the month of Morgan, May. So I'm all about birthdays, but this is how we're increasing deceased donation at NKF. We're working with an academic institution to increase the use of non-standard kidneys. Most people who are in need of a transplant, a life-saving transplant, will often say, "I want to hold out for the perfect organ." But it's okay to take an organ that might be a B plus, right? A person may not need an A plus organ, or, sometimes we refer to them as a better dialysis kidney. So we're working with this academic institution to educate people on what non-standard kidneys are. The government, the administration, Congress has taken a very close look at our organ donation and transplant center recently, and they've just launched the Organ Procurement and Transplantation Network Modernization Initiative. Organ Procurement and Transplantation Network is a fancy way of saying organ donation and transplant system. And the Health Resources and Services Administration is the government agency that is responsible for overseeing our transplant system. And so now HRSA is moving to modernize, to improve our transplant system so that it is more high performing, more efficient, and more equitable. And we need that, and we deserve that. We deserve in the United States to have a best in class organ donation and transplant system. So NKF is working very closely with HRSA to make sure that the patient voice is a part of the work that they're doing. And we want to make sure also to continue to steadfastly advocate for equity. We're also increasing deceased donation through innovative solutions, such as investing in startup companies that are that have a promise to increase organ transplantation. And then my last slide that I'm sharing with you all is this is how we're increasing equity in kidney transplants. One of our patient advocates recently shared, I fully support removing the race variable from EGFR calculations. As a Black patient who has collectively waited more than 14 years on the transplant list, the journey is daunting. Hope is diminished. Time is life when waiting for a life-saving transplant, and losing time due to inequitable equations is unacceptable. You heard Janice speak a lot about the removing race from EGFR. The National Kidney Foundation was an integral part of that initiative. We partnered with the American Society of Nephrology to create a task force to remove race from EGFR. At the National Kidney Foundation, we are also working to remove the African American donor ethnicity from the Kidney Donor Risk Index, something else that Janice spoke about. All of these acronyms are just they're fancy. They're just fancy for clinical algorithms that are used in kidney health. And the gist that you all should take away is that race has no place in clinical algorithms, especially when we know that race is a social construct and not a biological one. And so we want to make sure that any clinical algorithm out there to assess kidney function is race neutral, and that is what we're moving towards. I will say that the Organ Procurement and Transplantation Network is the entity that creates policy as it relates to the organ donation system. And so there is a policy right now that executive leadership at OPTN is reviewing to pass this policy proposal to remove, again, ethnicity from the Kidney Donor Risk Index. And then pre-waitlist data collection is something that's happening with the OPTN Modernization Initiative that I shared with you on the last slide. This is important because we need to collect data, and we can't just collect data. It needs to be able to inform policy to advance equity in transplant. So the pre-waitlist data just is going to give us an opportunity to see two things. One, who's referred for transplant, and two, who's making it through the evaluation process. This is very important because we need to be able to identify who's not being referred for transplant, which we already know, right? People that look like me. Black and brown people often have experienced delayed referrals to transplant. Sometimes they're not referred at all. So this is an opportunity to identify who's being referred, identify who's making it through the evaluation, diagnose why people may be experiencing hurdles to implement some interventions. And that is it. I'm going to share one last quote here. Receiving a transplant literally means everything to me. Living on dialysis is very hard. Living on dialysis is very hard. Dialysis is surviving. Transplant is living. And that is so true. But that is it. If you have any questions, please feel free to shoot me an email. And again, thank you to Rhonda and the California Black Health Network for this opportunity.
Thank you, Morgan, for being here today and for your unwavering passion around this issue. So good to see you again. And so we have our last speaker coming up, which is Mr. Roisin McLaughlin. And Roisin is a 7-year post-surgery recipient of a heart and kidney transplant, so a double transplant recipient. He advocates for patients from diagnosis to therapy and transplant. He went through almost everything I think that a dialysis patient could go through, starting his journey at age 17 when he fell ill from a virus as a young person, which affected his heart, kidney, and lungs. And so he's taken his life experience and really turned it into his mission. And now he is able to advocate and share his experience to inspire others and explore other modalities to help people identify better therapies and improve health. So I'll turn it over to you, Roisin, to tell more about your story and share today.
Well, greetings, everyone. It's a pleasure to be here. Thank you, Rhonda, for the opportunity with California Black Health Network. I am simply a patient advocate. I am a person who has endured, as you heard, every scenario a dialysis patient can go through, from the beginning, from therapy, all the way up to the gift of life of a heart and a kidney transplant. For me, advocacy for self is the most prevalent thing you could do for your care. From the beginning, when you get diagnosed with high blood pressure, diabetes, etc., understand that what you're going through. If it's a kidney, understand what the kidney does. Understand what you need as a patient to make you feel normal again. Understanding the quality of therapy that you need to actually improve the quality of your life, as well fit your therapy into the quality of life that you're already living. One of the great things as my folks, our folks, we are very, some of us are very ignorant to our care. So the first thing is this: when it comes to dialysis, understanding that a kidney is a very prevalent organ in our care and what it does. Any organ that we deal with, understand what that organ does. And when you're in your doctor's appointments and they're telling you and they're giving you these diagnoses, one thing patients have to do is never be satisfied leaving the office not knowing everything that the doctor is saying to you. Make sure that when you leave that office, you're satisfied, you're asking all the questions, and make sure you get a printout before you leave the office. That way you understand, even if you can't understand right then, when you get home, you could take a look at what they said, understand and dig into it, and just basically understand for yourself. We only have one life, okay? God gives us several chances, but he only gives us one life and one day to pass. In that in between, take care of yourself. A lot of us have dealt with generational health issues. Grandmama had diabetes, auntie had diabetes, mama, now I got diabetes. Now I'm going to pass it on to our kids. We have to change our lifestyles. And it's the way we live, the way we eat, a lot of times have hinder us into going into these different failures of kidney or other organs. The main thing is understanding what's happening with yourself in order to get the best diagnosis. A lot of our panelists have spoke before about donors. Let me tell you, when it comes to donating as a patient in need of an organ, understanding what the organs do and if you could be a candidate to provide an organ or tissues to benefit people. A lot of people don't understand if a patient needs a liver transplant, it's the size of a quarter that a person can donate because the liver rehabilitates itself. For me, I'm a recipient of a heart and a kidney transplant. I've done all modalities concerning dialysis. In center, I was doing 5 hours, 3 days. I went to peritoneal dialysis. I did that for 6.5 years, never caught an infection, got close to getting my kidney transplant, did everything that I needed to do as a patient in order to get the kidney. Then I go see my cardiologist and he tells me, not only do I need a kidney, but I need a heart transplant. Based on the therapy of time that it affected my heart, it can't be medicated, it has to be replaced. I was one of the only patients in the United States that had a mechanical heart called a left ventricular arterial device, as well as I was doing solo home hemo by myself. And how I got my heart and kidney, let me tell you, it wasn't through the transplant list. Normally, just to let you know, when a patient is on the transplant list, it doesn't matter how long they're on their list. When you ever make it, they only give a patient one opportunity at the top of the list, and that's 30 days for you to find your organ. And March 30th, on March of 2017, I got moved up to the top of the list. And unfortunately, the 30 days it took, they couldn't find me a heart nor a kidney. And let me tell you, I went into a deep depression. But I want to share my testimony with you to let you know that there's other ways of obtaining, and God has a blessing for you in his own time. What happened to me is that I was going through a few months of depression, and God sent this angel to me. It was my neighbor, actually. She knocked on my door and she was like, Rock, I've been looking for you. She told me that her daughter just got her pancreas and kidney transplant. She said, I want to tell you something. She says, every time I pray for my baby, I pray for you. And she says, God's time is the best time. And she says, you're next. Right before she walked away, she looked at me and said, Rock, trust God and don't waver. When she said those words to me, God told me back in 2009 when this started, he told me that my faith has to be the concrete I stand on, and trust him and don't waver. So when she told me that, that was the confirmation I needed for me to pick myself up out of my depression and continue to fight for my life. A few months later, I get a text message from my ex-girlfriend's nephew. He's down in New Orleans having the time of his life. Said he never looked at his phone, walked into a barber shop, and there was an old gentleman talking about God and love. He plugged his phone into charge. As soon as it did, the first thing that popped up was social media. His family was asking him if he knew anyone who needed an organ. So he says, Rock, do you still need a kidney? And I'm like, yes. But then I thought to myself, I need a heart and kidney. So whoever's going to have to give it to me, of course, is going to have to be deceased. He says, contact my aunt. I called his aunt and found out at that moment his aunt was my ex-wife's cousin. I said, hey, she says, Rock, she says, give me your information. I get off the phone with her and I call my transplant team up. And I'm on the phone with them simply as, hey, is this even possible? Before I can hang up, she calls me back and says, can you get to the hospital right now? I rush to the hospital. I'm doing over 100 miles per hour, fast and furious. I get to the hospital and she's standing outside. I park my car. I walk up to her and she says, Rock, my nephew got into a motorcycle accident and he's on life support. I immediately grab her and I just love on her. We get into the hospital and get down to the ICU. The doors open and a doctor and a few nurses walk up to me. The doctor walks up to me, grabs my hand and says, brother, I've been doing this for over 30 something years. I've never seen a patient meet the donor. And he says, you are truly blessed. At this moment, my anxiety is flooring. She walks me into this ICU unit and it's a 23-year-old kid on life support and his whole family's in the room with him. I walk up to the kid, I grab his hand and I pray over him. And then I gather the family together and I'm praying with the family, just loving on them. Within 10 minutes of me doing that, they called me and told me it was a perfect match. When I tell you, I'm going on 7.5 years post-heart and kidney transplant, 0 rejections for the organs, 0 rejections for the immunization pills. God put a reset on my life. I've experienced every scenario a patient can go through from scratch, all the way up to the blessing of a heart and kidney. For me, being an advocate and being able to educate patients to be an advocate for themselves is so prevalent in our community, because a lot of times we only listen to what the doctor says, but we really don't follow instructions too well. When we get diagnosed, we're supposed to know that at that diagnosis, they let us know that, hey, if we don't take care of these issues like diabetes, if we don't control it, if we don't control that blood pressure, it leads to organ failure and different critical illnesses. So to get educated about the things that we need to do, the adjustments we need to make in our life, those things can make the biggest print for the long term. Because until you start now, and what you do now would affect later on. So for us, hey, if grandmama had it, what are we doing to fix it? Why do we still have high sugar? Give up the sugar. Why is our blood pressure still high? Take our pills. Find a diet that controls the blood pressure. Find a diet that controls the diabetes. And once we head that up, it's going to prevent our culture, prevent our community from going down this road from needing an organ. But nevertheless, understand that the gift of life is the goal. And we need education in our community about our diagnosis, about our therapies, and take it seriously, because our lives do matter. And once you know what's going on with you, and once you're educated fully, you can make an educated decision about what you need to do to continue the survival of your life and live the quality of life that you deserve. Listen, I'm honored to be here. I'm honored to share my testimony with you. But as a community, get educated. We have resources. You're not alone, okay? There's a community of patients out there that communicate with one another. We uplift each other. And once you learn about your diagnosis, educate your family. Because a lot of time as patients, we're going through what we're going, and a lot of people don't understand what we're going through. So a lot of times family only see the smile, they see our face, but they don't know internally what we're going through. So once you're educated about your diagnosis, educate your family. That way they can get on board, understand what's going on with you, and then that helps us all together, inside, emotionally, physically, and mentally. But stand on faith and understand that what we're going through is only a transition until we get that gift of life, which is an organ. But in the meantime, educated about the type of therapy that you need to keep your same lifestyle going on. I'm here, I'm a resource. Please utilize all these resources that you have. We're trying to save your life. And God bless you. And thank you for having me, Rhonda.
Oh, thank you, Rasheen, for sharing your story. That was amazing. You gave me chills just listening to your journey, and your faith, I think, is definitely something we can all learn from, right? And so I don't see any questions in the Q&A box. I'm going to ask Aaliyah if there are any questions. I see there's some activity in the chat box, but are there any questions for any of the speakers? And if I could ask Ambria to put us all on, you can pin us all, actually. Yep.
So there are questions. I'll read them in order. So Tania in the chat asks, how can we increase the use of recovered kidneys that are discarded for transplantation? Is there a way to educate both patients and kidney transplant doctors? And that's for anybody.
Yeah, I'll take that one. Yes, I think Denisha, I think it's her name. She had initially up top said that, and I don't want to use the word discard, because out of respect for donor families, it's better to term it utilization. And yes, it is unacceptable what we're seeing in this country when in terms of the utilization rate. I do believe that there's a multitude of reasons why a kidney may not be used. Until that physician has the kidney available to them to visualize, and sometimes may have to do some additional testing, it is subject to not being used. However, there are some things that we do have control of that we've got to do a better job at. And that is around getting the kidney from point A to point B in a timely fashion, and also looking to make sure that we are able to visualize it from point A to point B. So for example, some areas of our country get really, really hot. And so if you know that most kidneys travel commercially, making sure that it's packaged in such a way that it can make its destination without the temperature changing. So now we have all kind of devices and everything that we can track. I can literally, not on my phone because I would get too many pings, but my staff has the ability to track the packaging of that kidney, making sure that it stays at a normal temperature, the temperature that is required in order for it to be used. And so we need to standardize how we move kidneys in this country from point A to B. And that is a work in progress. And if there is a variation, unfortunately, some organizations are better than others. And that's where a lot of collaboration and that best in practice concept that is being pushed by the modernization effort that will help us. Are we using the right systems? You know, if I just got a ping from Amazon to let me know there's a package at my doorstep at home, and there's a picture of it too, why do we not have that technology that can let us know that that kidney has reached the OR safely for that recipient? So these are the things that the modernization effort will help us work on and standardize across the country. So no matter where the donor is, the organs are going to be able to be transported safely. And so again, it is bad, and I'm going to own that and acknowledge that. But there are several OPOs, and again, with the support of the government, we're looking for ways to bring that number down. I am proud that we're well below the national average at our organization in terms of utilizing more kidneys. So in other words, we don't have a very high discard rate, but I'm very alarmed that I've seen discard rate as high as in the, utilization rate as high as in the 40% range. That is bad. And that cannot continue to be.
I'll just add really quickly too, for the transplant center side, it's really important that patients are active participants in their healthcare. And I think it's really important for physicians to be educating patients along the way, especially regarding the types of organs that are available, because typically patients are going to be less risk averse than the transplant center. If I've been on dialysis for 13, 14, 15 years, again, I may want the B plus kidney. I may not want to hold out for the A plus kidney. The B plus kidney will do me just fine. So I think it's just a matter of also educating people, patients, and transplant center staff need to do a better job at having shared decision making as a priority when it comes to care.
I would
Totally.
like to add.
Yeah,
More-
go
I would
ahead.
like to add as well. As a patient, when I talk about educating, understand that when it comes to the transplant list, okay, there's a lot of red tape. The quickest way for patients to get the kidney is this: know your blood type. All right. I'm O positive. It's a very common blood type. Every third person you bump into is O positive. When it comes to the transplant list, normally there's two types of kidneys they provide. One is a cadaver, it's a deceased person kidney. That can last you 10 to 11 years. But I'm gonna let you know something. A healthy person can live a great life with one kidney. If that person blesses you, there is no expiration date on that kidney. It can literally last you a lifetime. If that person donates you a kidney, they're out the hospital in 2 days. You're out the hospital in 1 week. And let me tell you something. When you get that gift, as soon as you come out of your sleep, they're going to get you up and start walking. The second thing is you're going to notice is that your skin complexion, and let me tell you, for us, it comes back glowing. You're going to feel like God gives you 10 years back on your life. So when I talk about being an advocate, don't be scared to ask. Closed mouths don't get fed. But be an advocate for yourself and speak up, because I'm going to tell you what, there's a willing person that's going to bless you. We don't know the time or the day, but keep your faith and keep speaking, and your gift will come.
Thank you, Rasheen. Aaliyah, are there any other questions in the chat?
Yes, so for Morgan, Miss Vinny asks, what is the NKF position on the recent transplants with gene-modified pig kidneys?
You're on mute, Morgan.
Thank you. The National Kidney Foundation is all about innovation. We know that there are a limited number of deceased donor and living donor kidneys to go around. So we know that there's a lot involved, especially as it relates to ethics, perception, public perception, patient education. But our position is that we need innovative solutions to make sure that no one's dying from kidney failure. And xenotransplantation happens to be one of those innovations.
Great. Thank you. Thank you, Ms. Vinny, for the question and for being here today. Aaliyah, do we have any other questions in the chat?
There's one more from Cynthia. What type of initiatives are you doing in your communities to share, educate, engage, and motivate donors?
Hey, Tiffany, do you want to take that?
Yeah, I'll jump in on that. It's important to really make sure that, as Janice mentioned early, that we're reflecting the communities that we're serving. And so One Legacy, under my leadership, we have been actively in the community, engaging groups like CBHN. We host a panel series, Connecting the Dots. And what we've now started to do, I'm on an HBCU coalition with Charles Drew, is that we want to provide services in the community. So that way individuals can come and they can get, high blood pressure checkups. They can, do urinalysis. They can get access to some of the, treatment that they typically don't have access to. And then, just piggybacking off, someone said earlier, you don't know what you don't know. And so it's really important to create those platforms where we're able to educate the patient to be your own advocate. Even like you said, Roisin, I currently have a sister-in-law waiting, and my father also received a heart. And we didn't really know how to navigate that process and, what was the outcomes or what they would be. So just really creating platforms where we can use the voice of those that work in the industry, but also people want to hear from real people. And so that's why we use the voices like Ms. Vinny and others to really share and provide insight. And then we come with those resources and education.
Thank you all. I just want to be mindful of the time. I think there's so much more we have here to talk about. But want to ask one question because I think it's an important question. So if someone is interested in becoming a organ donor, how do they do that? What should they do? Either one of you
Yeah.
can answer that. Yeah.
There's a couple of ways, but one, you do it at the DMV when you go there, but you can go to One Legacy's website. We do have a link there. I'll put the website in the chat, and you can register to be a donor, www.onelegacy.org. And there you can register to be a donor. It is a short questionnaire. It will take you all of 5 minutes. And it is important because we know we're hearing what these outcomes are. There's not enough organs. The need outweighs the supply. So we do need more registered donors.
Great. And I know, Rasheen, like it's important you tell your story in more ways than one. And I think if you hadn't shared your story, your journey about what you were going through before you got your double transplant, then probably the folks you said, I think in Louisiana wouldn't have known that you were in need of one. So, so I don't know if you want to comment on that question at all.
Yeah, it's very important to get educated about donating, especially for those who are in need of it. And that way we can explain to those who are curious and considering. It's understanding what it would do, how they would feel. And let's say for kidneys, for instance, when I talk about a person who's healthy, they can live a great life with just one. There's so many people who have donated over time, and it's like you never really get an opportunity to speak to these individuals. But I can tell you they're living fruitful lives and still doing what they need to do. And for the patients who are recipient of it, when I tell you it extends their life. Dialysis is harsh. Prior to me starting it, I was in a corporate life, working 65 hours a week, trying to move up in the company. And when I got told that I needed to start dialysis, it was like Mike Tyson bust me right in my gut. Life changed, income changed, emotional, mental, everything changed. And it's an adjustment. The only thing I wanted back then was somebody to help me through the ropes. The only person I ever knew in my family who was on dialysis was my grandmother. And she passed away. So I already had a bad impression about it. And when I ended up in the clinic, 5 hours for 3 days, let me tell you something, things changed. And until I educated myself and learned for myself, that's when the beginning of my transition started to occur. I got a better quality of therapy. And when I got a better quality of therapy, I felt better to fight against these other things like cardiology and all these other things, neurology, endocrinology. As a patient, when you're dealing with different specialty doctors, okay, I want to let you know, none of these doctors really communicate with one another. So you as a patient, you have to be an advocate to be able to share. I spoke with this doctor, they put me on this prescription and this. The one thing about prescriptions, and I tell anyone this, whenever you get a new prescription, read the description and the side effects. And if you don't agree with the side effects, you go back to your doctor and you tell them, I would prefer something else. And guess what? They have something else with lighter side effects that could benefit you. As a patient, your best friend is your pharmacist, Walgreens, CVS, or wherever you go to. The pharmacist knows about the prescriptions you're on, the side effects, and those that are available for you that don't have those side effects. Advocate for yourself. As I mentioned, nobody takes care of you like you. Know about you and listen to your body, okay? If you're tired, sit down somewhere. Take it easy. Your peace, your health, your joy, that's life, and you got to live it.
Thank you so much. Yes, I think, again, regardless of what your situation is, it's always important to be able to advocate for yourself and your loved ones through whatever health situation that you're dealing with. And so I want to take a moment to thank all of the speakers here today. I really appreciate you being part of an important conversation and helping to build awareness about the importance of organ and tissue donation and transplantation in our community. And so for those of you that are still on, we would love to get your feedback on how we did today. I know that Aaliyah actually put the link to the survey in the chat, but you can also scan it here and provide your feedback so that we can know what we need to do better, perhaps the next time around. So next slide, please. And we've got a few things coming up over the next couple of weeks. We're really excited about Black Health Equity Advocacy Week. We were the first state in the union to actually cultivate or get the opportunity to get a resolution passed to declare the first week of May here in California as Black Health Equity Advocacy Week. Not just this year, but every year in perpetuity. So this year, we're really focusing a message on we've got the power because we do have the power to really make the healthcare system work better for us, to be our own advocate, to really improve our health outcomes and rewrite our story. We know that Black Californians live about 5.5 years less than the state average, but it doesn't have to be that way. So we're working very hard to make sure that we're all part of driving this movement to a better health outcomes for Black Californians and hopefully, spread that word across the country as well. So keep your eyes open, follow us on social media if you're not already doing that. So next slide, please. We've got a few upcoming events in addition to Black Health Equity Advocacy Week. On May 11th, we are participating at the KJLH Women's Health Expo down in Long Beach. So we have a breakout session where we're talking about the work that we're doing with the California Healthcare Foundation, really, again, around helping us understand better how to make the healthcare system work for us. So the topic is going to be, how do we put the care back in healthcare? So for those of you in Long Beach or who are planning to go to that event, please check us out. Our breakout session is at 10:30. And then we also will be going to San Diego for one of our Black Health Network member networking events in person at the Mental Bar in San Diego on May 16th. So you can register on our website by looking for the events tab, and then under current events, you can register there. And then I think I have one more slide to cover, and then we're all free to go. And so you can follow us and connect with us on social media, on Facebook, on LinkedIn, on Twitter, or now X. And we also have a YouTube channel and we're on Instagram. So very easy. It's at Your CBHN, with the exception of the YouTube and on LinkedIn. So it's just California Black Health Network there. And you can also join us in the campaign for Black Health Equity. That's the work that we're doing to really invest in what is needed, the programming, the advocacy and policy work that is needed to really close the gap in health disparities and improve life expectancy of Black Californians. So with that, I will say thank you for joining us today. Hopefully this was really important and valuable information for you and also for you to share with folks in your network and community. So thank you again. Have a great afternoon, and we'll see you soon at the next event.